As a very busy plastic surgeon in a big city, it's very competitive. And I may do excellent injectables, injectable soft tissue fillers, and excellent laser resurfacing, excellent suture suspension thread lifting. And the thing that might differentiate me from a competitor or reason why a patient might not come back for maintenance treatments is the number one thing we often fail to control: pain. P word, the P word. The pain word is a very bad thing in clinical practice. When we induce pain, even with a tremendous outcome, we find that patients, subconsciously or consciously, are not going to come back. And so they may have a great result. They tell all their friends they look amazing. Your injectable, your microcannula, your volume, your Botox, your laser resurfacing, your suture suspension thread lifting look awesome. But then their friends ask them one thing: Dr. Mulholland did a great job, but did it hurt? And if it did hurt, it did cause pain. Patients can be very reluctant to refer friends to you and very reluctant to come back for the maintenance. So one of the most important things you're going to do in your aesthetic practice is manage pain effectively. And there is no better way, in my opinion, to manage outpatient, non-invasive pain like the use of nitrous oxide. So what is Pro Nox? Pro Nox is one of the largest vendors of nitrous oxide for medical and dental use in North America. It's one of the slickest units out there. It's a very cost-effective way to manage growth in your practice. Manage growth through the use of a nitrous oxide to control and modulate pain. How does nitrous oxide work? Well, nitrous oxide is laughing gas, been around in dental procedures for 30 or 40 years. It's just now being introduced into aesthetic medicine because we can now get it in 50%. At 50% strength, 50% nitrous oxide, you can legally drive in most jurisdictions after 8 to 10 minutes. Makes it very valuable for your injection patients, your energy-based patients. They can come in, get their treatments under nitrous oxide and Pro Nox, and go home 10 minutes later. How does Pro Nox work? Pro Nox is a nice, self-contained, mobile analgesic. It's not an anesthetic, it's an analgesic. And it works by the release of serotonin and dopamine, the neurotransmitters of well-being. So as you inhale the gas, within 6 to 8 puffs, you're going to get a tremendous surge of serotonin and dopamine in the hypothalamus, which modulates the perception of pain. So your cortex, with a surge of well-being neurotransmitters, tells that the hypothalamus that's feeling the pain from the laser, the pain from the injection, the pain from the filler, be quiet, I don't care, I'm good with it. And so I tell patients that nitrous oxide or laughing gas makes you feel a bit giddy, and it's kind of like fun pain. You realize the pain is going on, but you don't really care about it. And most patients love the fact that they don't feel high or stoned, but they just feel a sense of euphoria that washes over them and minimizes the pain they're experiencing. So Pro Nox equals no pain, and no pain equals growth in your practice. But where does it make it real money? It makes its real money, Pro Nox, on retention, on patients having a great experience, telling their friends, coming back for more treatments, and growing your practice.